The first chairperson of the board of Benjamin Mkapa Foundation was then the Deputy Minister for Health in Tanzania,
wa kwanza wa bodi,
the current president of Zanzibar,
ambaye sasa hivi ni rais wa Zanzibar, Dr. Hussein Mwinyi. Yeye alikuwa ni mmojawapo wa waanzilishi.
Through this foundation,
kupitia taasisi hii, Benjamin William Mkapa aliweza kufikia moja kwa moja milioni 12 katika utoaji wa afya dili wanafunzi tofauti 736 katika maeneo ya afya, na wengine wameajiriwa katika serikali, na wengine ni maofisa wakubwa katika nyanja mbalimbali.
Helped to renovate, build, uplift at least 536 health facilities across the country. This is mainland and Zanzibar.
Aliweza kujenga vituo mbalimbali ambavyo vipo Tanzania bara na Zanzibar vinavyofikia 536.
Rais wa Zanzibar, Mheshimiwa Rais mstaafu wa Jamhuri ya Muungano wa Tanzania, waheshimiwa na marafiki wa hayati Benjamin William Mkapa, makamu wa kwanza wa rais na makamu wa pili wa rais wa serikali ya mapinduzi ya Zanzibar, Mama Ana Mkapa, na ambaye ni mke wa hayati Benjamin William Mkapa, waheshimiwa mawaziri kutoka serikali ya muungano na serikali ya mapinduzi ya Zanzibar, mabalozi na kisha jumuiya za kimataifa, wageni waalikwa wa taasisi ya Benjamin Mkapa, marafiki na familia, habari ya asubuhi. Nitumie fursa hii kuwasalimuni nyote kwa salamu yetu maarufu, in the name of the Republic of Tanzania. Ninawashukuru, nasimama mbele yenu kuwashukuru kwa kuungana nasi katika kumbukizi hizi kwa heshima ya hayati Benjamin William Mkapa, ambaye ni rais mstaafu wa Jamhuri ya Muungano wa Tanzania na mwanzilishi wa taasisi ya Benjamin Mkapa. Na washukuruni nyote kwa kuwepo hapa na kutenga muda wenu kwa ajili yetu. Tumesikia heshima kubwa kwa kupata wakati kuwa pamoja nasi. Kwetu hiyo ina maana kubwa sana. Tunakushukuru Mheshimiwa Dr. Hussein Ali Mwinyi, rais wa Zanzibar, kukubali mwaliko wetu kuja kwenye kumbukizi pamoja na kwamba wewe ni mwenyekiti wa bodi iliyoanzisha taasisi hii, lakini tunashukuru kuwepo hapa, na kwa kweli umetugusa sana kwa uamuzi wako wa kuwepo pamoja nasi, na kwenu nyote ambao mmekubali kuwepo. Hii ni fursa kubwa ya kutumika na kuweza kuleta mabadiliko. Hatungeomba kitu kikubwa zaidi ya hiki. Yeye ndiyo anatudai, tunawiwa zaidi kwake uzoefu wake, hasa katika mwelekeo wake wa mfuko wa afya kwa wote. Lakini pia tunataka kuanzisha mfuko wa uwekezaji. Tumejitahidi kuishi tumefuata urithi wake hasa katika kuandaa tukio hili, lakini nafahamu kwamba ni ngumu sana kuishi maisha hasa aliyoishi yeye. Kwa hiyo tafadhali, kama tutakuwa na mapungufu yoyote, tunaomba mtusaidie, na tunaahidi miaka ijayo tutaboresha zaidi. Waheshimiwa mabibi na mabwana, ni kwamba watu wakubwa kama hawa wanaweza kufa, lakini urithi wao utabaki baada ya wao kuondoka. Lakini hiyo si kweli kwa hayati Benjamin Mkapa, na ndiyo sababu tuko hapa kusherekea maisha yake, kwa sababu ni maisha ambayo aliishi vizuri na alitumia muda wake vizuri. Na katika kitabu chake cha My Life My Purpose alisema, nitaishi na kuamua ni nini ambacho nataka kukifanya duniani, mabadiliko gani nataka niyafanye duniani. Na sisi katika taasisi yetu tumeamua kuelezea simulizi hizo. Kwa hiyo tutaangalia baadhi ya video ambazo zitaonyesha safari ya Benjamin Mkapa. Na shukuru sana kwa kunisikiliza.
Kongamano in Tanzania since independence. The late His Excellency Benjamin William
Right to official and a diplomat serving as the United States Ambassador to Tanzania since 2020. As a medical doctor and a career member of the Senior Executive Services, Dr. Rais has served in acting and a permanent position in the U.S. federal government, including the Secretary for Health and Human Services, which is the Minister for Health in the U.S., Assistant Secretary for Health, Principal Deputy Assistant Secretary for Health, Deputy Assistant Secretary for Health, and Deputy Assistant Secretary and Health Promotion. Over his course of his career, Dr. Rais has been the forefront of public and population health in the U.S., health promotion, healthcare delivery, healthcare.
When we were asking for independence, we were asked, why do you want independence when you only have 4 doctors? And look at a person like her, and she represents many, many more. And even then you could see the growth, incremental growth in the number of human resources for health, although I would let her go and say that is also a constraint right now. And I'm so happy to meet Mr. Ndumbaro, because I hope I will have time to discuss some issues with him in private. The village health worker started very early, and that was, I think, the first indication of Tanzania's seriousness in universal health coverage. So, thank you. So we've made a lot of progress. Currently, as I speak, we have IT in health, which is a major game changer, I would say. We also have a lot of several high-level consultants and technicians who can manage pretty much every disease that you can think of in Tanzania. So that is from the higher level, but also from the level right down to the village, where we started with village health workers, and we now have community health workers, as Ellen aptly talked about. So we also have a number of infrastructure and still growing. Initially, we were supposed to have a dispensary per a population of 5,000. The National Health Insurance Fund and improved Community Health Fund bill and table it to the Parliament. We need to raise awareness and popularize health insurance as a strategy nationwide. Awareness on the plight of maternal health, infant health, which also includes the first 28 days of life, which is a reflection of the health of the mother, by the way. And we also need to address the issue of cultures that mitigate against health and welfare of children, adolescents, women, and few men.
Complement government efforts in various areas. And the side strategies that we are working on is to try and develop a program working framework that will allow us to absorb those who are not employed as volunteers to work in the different government facilities. And our focus will be mainly borrowing from the Mkapa Foundation, the spirit of Mkapa Foundation to deploy them in the remote areas where, the only facilities that you can find there are government facilities. And if you don't have workers, then, it becomes a crisis. So we'll develop the volunteer program framework that will enable us deploy volunteers to those areas. Those are the three major strategies that we're going to use.
Thank you very much, Dr. Ndumbaro. As we are discussing about universal health coverage, we are all aware that the pattern of disease is changing. In the early years, we were focusing on communicable diseases, but of late, we are seeing a new pattern of non-communicable diseases, which are very different, by the way. With communicable diseases, you get sick once, you get treated, you never go back to the health system. With the non-communicable diseases, once you get sick, you are permanently fixed in the health system for the rest of your life. So you're seeing this changing burden of disease in Tanzania with non-communicable disease of COVID-19, which builds a strong case to invest in communities, health promotion, and health prevention programs. What do you see the role of community health workers in this setup?
Thank you, Mr. Moderator. I agree with you that the community health workers, employing them is a good idea, but we should also go back to our rich history of dealing with this type of things. I remember in the 1970s and 80s, when we had communicable diseases problem, we used to have sustained health campaigns, across the country.
For health, talked about. So we also have a number of infrastructure and still growing. Initially, we were supposed to have a dispensary per a population of 5,000. Currently, we have some dispensaries with inpatient facilities, but also almost all health centers having surgical facilities.
Executive Secretary of Club of Madrid, Maria Aguero, is following up this event, and representative of our generations. Your Excellency, allow me to note those who are present with us here. This is an event which is followed globally. Some of us are here physically. Your Excellency, and today we are celebrating his life and live his legacy. The main theme of this symposium is creating such.
We may not be perfect, but still we love you. May your eyes be always on us. Our hope is in your merciful love. Rescue us from this terrible pandemic of COVID-19 and from all evil that surrounds us. Restore calm and peaceful attitude in us all. We ask this through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit.
Amen. Thank you very much. Your Excellency, we thank you for your time this morning to be with us to celebrate a year after the passing of our.
There are the extreme cases, areas of extreme cases, but we can also, as I said, embody it or mainstream in the primary school, secondary school, health education, and then people will be more aware of that. Thank you.
Thank you. Thank you very much, Dr. Lauren Ndumbaro, for those wonderful remarks, and I'm going to give you time to wrap up at a later stage. My third speaker is Mr. Sanjay Rugan.
Thank you.
Who is representing the private sector. And as you know, the private sector is an important partner in the journey towards universal health coverage. How do you see the private sector complementing the government's efforts towards universal health coverage?
Thank you, Mheshimiwa Waziri. And I think we very significantly contribute. But I think it's just to take a moment on what private sector means. So I think as a nation and across Africa, 80% of whatever is produced in our countries comes from private sector. 75% of the total credit that is taken in most of our countries is taken by private sector. 65% of the total investment in any country is done by private sector. And 90% of the people employed in the formal sector are employed by the private sector. So that's the strength and the machinery that the government or any nation has. And I can tell you that in every country where there's been progress in the health system, it's really because there's been significant collaboration. I must also say that, when you talk about universal health coverage started in 1978, if I remember, 43 years ago. When we started universal health coverage then, the role of the private sector was just a little bit of production, a lot of procurement, and a little bit of distribution. Now, statistics shows that anywhere between, in a year, from 25% to 40% of the contribution in the health sector could be from the private sector. Currently, we are now involved in knowledge, in education. Mheshimiwa talked about campaigns, services, products, goods, manufacturing, value chain impact. We are using technology as an enabler. A lot of work is happening on logistics. Like I said, 80–90% of the total distribution happens through private sector. We've also really expanded on our partnerships. In olden days, and Mheshimiwa Balozi will talk about it, that in the past, the donor agencies could just fund us. But now we are creating economic sustainable models, and that requires private sector. So we have had partnerships with various development partners, with UNICEF, with AMREF, and that's a big thing we've done. I also want to say that the private sector is what finances a lot of the interventions that we do. Now, just citing a couple of very quick best practices. Tanzania has made so much progress, including through Mkapa Foundation. We boast of some of the best hospitals now. So, if I talk about Aga Khan Hospital, it is amongst the 9 accredited hospitals in Africa. And we don't even know about this. They do a lot of work on cancer, on gender equality, CCBRT, from a disability, eye care, gender perspective, do phenomenal stuff. And this is all private sector interventions. The financial services industry, Standard Chartered Bank, where I come from, we've spent $7 million in the last 5 years just on eye care. ICNBC, my friend sitting there, CRDB, NMB, everybody is putting in a lot of effort. We need to just coordinate these efforts. You look at mining companies. You look at Dalberg that is doing a lot of research work. And then finally, MNOs, I think are very critical as we evolve. And, data is going to continue to be very critical in essence. And finally, I would say that, when you talk about private sector, whilst we have done a lot to manage the burden so far, the burden of health, and I know that COVID has taught us, is very, very huge. Just in terms of statistics, if you look at Africa, 11% of the world's population is in Africa. 24% of the total global disease burden is in Africa. We only have 3% of our workforce that is involved in health, so we have a lot much more to do. And only 1% of the global investment goes in Africa health. So there's so much more to do. Thank you.
Thank you for that intervention. If I don't ask you this, I'm not going to sleep tonight because I'm the minister responsible for communication, but also the digital transformation in this country. You have highlighted some of the issues here and the engagement of the private sector. How do you see the role of digital transformation and the technology in filling the gaps that you see in the health sector from the private sector perspective?
Waziri is talking about his house now, ICT. I think ICT can give us exponential transformation, whether it is in health or many things. But if you just talk about health, you talked about communicable diseases, non-communicable diseases, or pandemic now, because it's a big thing. So whether it is in the adaptive technology, what is adaptive technology is, we are a very resource-constrained country. And a lot of the equipments that we need to be made for resource-constrained countries. And these are technology interventions. So whether you use GE or many other organizations, Philips, they can be of huge support. But let's talk about data, because that's where you come in. And I must congratulate you because your ministry started only in November last year, and you've already started to involve us in making the blueprint, which is very important. So here is the magic. If we collected all the healthcare data from the providers, if we collected all the MNO data on the population, the concentration, and the social behaviors, if we collected all the data from financial services, the utilization, from all the food chains and how we consume food, from the bottling companies, from insurance providers, human resources as we talked about. Imagine the data we have to make good decisions. So decision making becomes better.
Sorry,
we can manage workforce better.
We'll take a pause as Her Excellency is about to step in, then I will pass on the mic to Doctor. When she steps in, I will ask you all rise as Her Excellency President Samia step in any seconds from now. And Superintendent in purple, you'll be ready for the national anthem and East African as we start. May we all raise, please. Anthem, please, and East Africa anthem. Excellency, Madam Samia Suluhu Hassan, President of United Republic of Tanzania, we take great honor and thank you for your time this morning. Your Excellency, this global event that has collaboratively been organized between the Benjamin Mkapa Foundation and your government of Tanzania. Thank you very much for setting aside your time for this. Your Excellency, in this venue, physically, there are about 600 participants, but also, Your Excellency, this event is followed globally, and there are some few head of states who are following up this event. I'll mention a few who have participated or are continuing to participate. The former president of Mozambique, President Chissano, is following up this event. Former president of Nigeria, President Obasanjo, is following up this event. Right Honorable Tony Blair, the former Prime Minister of United Kingdom, is following up this event. Representative of former Prime Minister of Finland, Matti Ahtisaari, are following up this event. And if time permits, President Bill Clinton did promise he will follow this event. Your Excellency, we have national leaders, current and past, with us here from both Tanzania and Zanzibar. We have the spouses of national leaders, religious leaders, members from security organs, diplomatic corps and missions presented in Tanzania, academic institutions. We have the family of the late President Mkapa with us today. We also have private sector leaders, civil societies, as well as politicians from various groups. Your Excellency, a point to note, thank you very much. A point to note, Your Excellency, of particular importance, and this group of requests to Mkapa Fellows. These are medical staff who were recruited by President Mkapa when he started this foundation in order to serve the marginalized and underserved. But here we have about 10 of them representing others, and I'll request them to stand. You recognize Mkapa Fellows. Thank you very much. Your Excellency, President Benjamin Mkapa also had recruited over 5,336 health workers, and these health workers have been deployed in rural areas, in some areas, in order to complement your government effort in provision of health. Some of them have been
scalability. And we talked about healthcare data, MNO data, financial services data, food industry data, bottling company data, insurance company data, and human resource data. And I said with your ministry and the fact that we are doing a blueprint, it was really going to help us in decision making, workforce management, health commodities, which means supplies and production, and also investments. And I think finally, it also helps us for partnership management, because in which areas we need to focus. So I think I would end at that for now. Thank you.
Thank you very much, Sanjay. And our last panelist for today is His Excellency Dr. Donald J. Wright, the U.S. Ambassador to Tanzania. Dr. Wright, Tanzania has made huge strides in the health sector in partnership with the development partners. What are the initiatives or strategies that DPG and the USG have been implementing to support the journey to self-reliance and universal health coverage? And what opportunities do you see that need to be capitalized on?
Thank you. Thank you very much for the question. Well, as it relates to self-reliance, let me assure you that the United States is committed to promoting self-reliance in our partner countries around the world. In Tanzania, this is particularly appropriate because the country was founded under the principles by the late father of your country, Julius Nyerere. And that commitment to self-reliance has been championed by successors, including the late Benjamin Mkapa. The United States has a long-standing bilateral relationship with the people and government of Tanzania, and this year we're celebrating 60 years of working together, Pamoja 60. As it relates to the development partners, let me say that over the last 20 years, Tanzania's Health Basket Fund has proven to be an excellent mechanism for strengthening Tanzania's health system and delivering results for the poor and vulnerable. This project brings together resources from multiple international development partners into government health systems to work on achieving agreed upon goals. While the United States does not contribute directly to the health basket, we have seen the effectiveness and support joint goals through the provisions of technical assistance. As it relates to UHC, let me say that the efforts of the development partners to support universal health coverage aims at supporting the government to increase access to health services when and where they're needed, without financial hardship and without compromising quality. Tanzania is not there yet, but development partners have supported the government of Tanzania to develop systems, policies, and strategies to enact universal health coverage through a single health insurance policy. As it relates to the successes, let me say I would first like to take a moment to recognize the efforts by the government of Tanzania in reaching lower middle income status ahead of schedule. This demonstrates great potential to reach new development milestones, and we are committed to supporting Tanzania to achieve these. In our mutual goal of Tanzanian self-reliance, we must focus on sustaining and improving these economic gains and translating them into real increases in household incomes and the ability of each individual citizen, particularly in the rural areas of this country, to access quality health care. We development partners are committed to strengthening collaboration among ourselves and ensuring that our development support is well coordinated as we engage with our government counterparts. There are certainly opportunities of Tanzanian ministries and departments, and hope they will commit to the same level of coordination.
Thank you very much, Ambassador Rais. And now, to wrap up our discussions, I'll start from far left. Sanjay, I'm going to give you 1 minute. The President is here. The President of Zanzibar is here. 1 minute takeaway message. What do you want the President and the congregation to hear? 1 minute.
Okay, 43 years since we started universal health coverage. Our commitment is by 2030, we are going to hit massive milestones. How are we going to do that? My message to the government and is the partnerships we have seen in the last 43 years are wanting. We need to have real partnerships so that we achieve our targets in the next 7 years. My contribution to the private sector, the CEOs who I work with, is that including COVID-19 has taught us that investment in health drives economic prosperity, and economic prosperity drives business. Thank you.
You want to see more partnership and engagement of the private sector?
Absolutely.
Ambassador Wright, 1 minute. What prioritized action leadership and the stakeholders need to undertake going forward?
Thank you. Well, let me begin by quoting one of our former presidents of the United States, George W. Bush, who founded the PEPFAR program and launched global investments in fighting HIV and malaria. He once said, Africa's most valuable resource is not its oil, is not its diamonds, it's the talent and creativity of its people. Madam President, I urge you to continue investing in the people of Tanzania, particularly the youth. One of the most critical needs faced by Tanzania today is human resources for health care. In some remote areas of the country, 70% of healthcare positions are vacant. And overall in Tanzania, the vacancy rate is about 52%. While we've seen important strides made in increasing public sector hiring, critical shortages exist, which are particularly problematic for reaching goals around reducing maternal mortality. Midwives and doctors are needed to provide essential maternity care. More progress must be made quickly to expand all cadres of the health system to enable the nation to be resilient in the face of COVID-19.
Thank you very much, Ambassador Wright. You mentioned that we need to invest in the people and also build the capacity in the human resource for health. Dr. Fatma Mrisho, you've been very passionate about reproductive and sexual health. Now is the right time for you also your message to be heard. What is your 1-minute take-home message?
The first one is fully finance the 5th Health Sector Strategic Plan. I keep on repeating this because the 5th Health Sector Strategic Plan is for strengthening the health system. The second one is I keep on repeating, invest in human resources for health, particularly the ones that are missing most and key to reproductive health, since that's my topic. And pharmaceutical health assistance, very key. The third one is make maternal and child health issues a national priority. In collaboration with non-state actors, governmental organizations who are very capable of showing capacity in this country, as well as the private for-profit sector.
Thank you, Dr. Fatma Mrisho, for that very powerful closing remarks. And I'll end with Dr. Lauren Dumbaro. 1 minute take-home message.
Thank you very much. I think the first one is we should use the experience of 1970s and 80s in raising awareness of people against non-communicable diseases. And the second one is that as we work on the volunteer program framework, I think we continue to work, we'll need engagement of various stakeholders so that the government in long-term perspective may approve that volunteers in.
Thank you very much, Dr. Ndumbaro, for those remarks. You are mentioning that we should revisit. This is not a new experience, although the burden of disease has changed, but there are best practices from the past that we can revisit. But also, I'm happy to hear that you're talking about the volunteer program framework, whereby we can engage the unemployed health workers to provide service while we are building the capacity. Use them when you employ them, because they'll be providing service, but also they'll be getting the substantial experience while they... Now, I've wrapped up with the panelists. Now, I would like to welcome contributions from the floor. Okay. Yes, I've seen some hands. And I'll start with Dr. Khalid, the Minister of State, Vice President's Office, Revolutionary Government of Zanzibar. Could you pass on the mic to Dr. Ali? Dr. Khalid Mohammed is the Minister for State.
Thank you.
Dr. Khalid, you have 3 minutes.
Thank you, Mr.
3 minutes. Yes. Yes, sir.
Moderator, for giving me this opportunity to give my comments to the panelists. Excellencies, distinguished participants, ladies and gentlemen, first let me commend the Benjamin Mkapa Foundation for organizing this important event. I also commend the moderator and the panelists for the very insightful and enlightening discussion. My humble comments are centered on the need to have a multi-sectoral approach and effective coordination mechanism in health-related issues. As we all know, the health sector has numerous sectors, as already said, but having different roles, objectives, and approaches in supporting and in the provision of healthcare services. These actors included the government, donor agencies, private sector, NGOs, CSOs, and others. But within the government itself, we have different institutions having different roles, and all those can contribute positively to achieve positive health incomes. We have, for example, Ministry of Agriculture. It has got a role of making sure that we have adequate, nutritious food for good health. Ministry of Water, for making sure that what we drink is clean and safe. Responsibilities for the Ministry of Communication and Infrastructures to ensure that
who enter school exiting. Today we only have a third of girls who enter primary school exiting and making it into secondary education and out into the world of work. Unless we address this barrier, we will continue to get adolescent girls who are mothers. We will continue to have girls who don't have access to health, education, and other rights, and their families won't have access to those rights. So working concertedly on addressing these gender barriers has to be at the heart of health systems work, because without this, we will not achieve those results. And I'm proud to say that with Mama Samia's leadership, she has already flagged this as a top priority. But I do want to say that currently we've made huge progress, but still less than 50% of households have access